This is an enterprise by Medico Abroad to highlight the importance of self-study amongst medical students. Medicine is a vast subject, and the more you study it, the more you realize that every bit of knowledge gained is but a drop in a never-ending ocean. This is an effort to assist future physicians, and it should not by any means be treated as a substitute for regular classes. Now, having said that, one does gather a lot of knowledge during the medical course, but it's like leading a horse to water. How much the horse drinks is definitely up to the horse, isn't it? But on a more serious note, once you become doctors, you become trustees of the human body. The well-being of your patient is your responsibility. Therefore, you must equip yourself with all the knowledge that you can gather. There's an old Chinese proverb which says, you hear and you forget, you see and you remember, you do and you learn. There can be no substitute to the student's initiative to learn better and to do more. You can augment your knowledge from a number of books. Today, we concentrate on pathology. This is a subject that deals with the structure and functioning of the human body in disease. It answers questions like, what is infection? What causes fever? How does the body respond in disease? Learning these basic phenomena is the key to treating these diseases. Now, to help you with pathology, there is a good book called The Pathological Basis of Disease by Robbins. It has wonderful pictures which can help you with histopathology, and the gross pathology is almost as if you're looking at live organs. The theoretical information goes up to the molecular level of pathology. It is a comprehensive, well-written and excellent book to follow. There is also another textbook of pathology by Harsh Mohan, but that is an abridged version, and you must definitely develop on the subject that is given in it. The topic for today is acute and chronic inflammation. Inflammation is a complex reaction to injurious agents such as microbes, damaged or dead cells, and it has three reactions: vascular reactions, migration of leukocytes to the extravascular space, and systemic reactions. The unique feature is the reaction of the blood vessels. The leukocytes from within the blood vessels, tissue fluid and edema accumulate in the extravascular space. The purpose of this inflammation is twofold. One, to destroy, to dilute and to wall off the infectious agent and to prevent it from spreading to other areas. Two, it sets off a series of events which try to heal and regenerate the tissue which is damaged. Inflammation is closely related to another process called repair. Repair occurs only when the noxious stimulus has been eliminated. Repair of the tissue has two components to it. One is regeneration of the native parenchymal cells and replacement of the defect by fibrous tissue. It's a process called scarring. The purpose of this inflammation is twofold. One, it can be protective. The tiny infections that you have, sometimes you may have a common cold which, if unchecked, may track down the upper respiratory tract and become a lower respiratory tract infection or a pneumonia. Now, how is that prevented? When the upper respiratory tract itself is colonized, an inflammatory response is set up, different cells come to that particular area and kill the infection there itself, and this prevents the spread of the infection. That is, to destroy, to dilute and to wall off the infection. This is your protective response. Here, infections are treated and they are prevented from spreading, fractures are healed, and the body comes back to normalcy after a period of illness or infection with the noxious agents. The second type of inflammation is a harmful phenomena, where more harm occurs than good. This is the underlying pathology in chronic diseases like rheumatoid arthritis, systemic lupus erythematosus, and TB. Now let's look at something called an inflammatory response. In inflammation, there are two kinds of responses. One, vascular response. Two, cellular responses. Many tissues and cells participate in this vascular and tissue responses. The cells that are involved are: 1. Circulatory cells from the blood, which may be eosinophils, basophils, neutrophils, lymphocytes, and monocytes. These are the circulating cells which may be participating in the inflammatory process. 2. Substances from the extracellular matrix like structural proteins like fibrin and collagen. These are the cells that participate in vascular and cellular parts of the inflammatory response. These cells produce inflammatory mediators which are released either in response or are stimulated by the noxious stimuli themselves. Sometimes dead cells may also elaborate inflammatory mediators. This is especially seen in myocardial infarction after the cells of the heart have died. These cells elaborate certain inflammatory responses and contribute to acute inflammation of the endocardium or the inner lining of the heart. Now let's look at the two types of inflammation. One is acute, the other is chronic. Inflammation is of two types, acute and chronic. Let's draw a small table and see the differences between the two. First, let's look at the onset of inflammation. The onset of acute inflammation is rapid. It may take a few minutes or a few hours or even 1 or 2 days. The onset of chronic inflammation is pretty unsure. If you ask the patient, since when do you have the problem? And he will not be able to pinpoint a certain time in the past since when he noticed that the infection has started. This is called an insidious onset, where the time period is definitely long, the starting of the infection is very slow and quite mild. This sort of onset is called a insidious onset in chronic inflammation. Now let's look at progress of the infection. In acute inflammation, it is definitely fast. The infection is very quick or rapid. In chronic inflammation, the progress is slow and long drawn. It is mild, but it continues for a longer period of time. Next point is exudation of fluid. There is a lot of fluid which is exudated in acute inflammation. A large amount of fluid. Therefore, in acute inflammation, even the size of the swelling is quite large. In chronic inflammation, there is less to moderate amount of fluid which is extravasated. Then, the predominant cells. The predominant cells that mediate acute inflammation are neutrophils. Neutrophils are also called polymorphonuclear leukocytes or PMNL cells. The cells that mediate chronic inflammation are macrophages, lymphocytes, and mast cells. The last point is repair. In acute inflammation, the repair is either a complete resolution or regeneration. A complete resolution which makes the tissue go back to its normal structure, and or regeneration of the native parenchymal cells. In chronic inflammation, almost always the repair is by fibrosis. This table tells you the differences between acute and chronic inflammation. Let's look at the table once again. Acute inflammation, chronic inflammation, and the characteristic. Onset of acute inflammation is rapid. It could be a few minutes, a few hours, or 1 or 2 days. The onset of chronic inflammation is insidious. The progress of acute inflammation is quick. Chronic inflammation is slow, mild, and long drawn. Exudation of fluid in acute is a lot of fluid. In chronic, less to moderate amounts of fluid is exudated. Cells which mediate acute inflammation are neutrophils and polymorphonuclear leukocytes. Neutrophils or PMNL cells. The main cells that mediate chronic inflammation are lymphocytes, macrophages, mast cells. The repair of inflammation is by complete resolution or regeneration. Chronic inflammation is repaired almost always by fibrosis. Now let's look at acute inflammation. Acute inflammation serves to deliver the cells which will handle repair of the tissue to the particular site of injury. It delivers the cells which mediate repair to the particular site of injury. This is the purpose of acute inflammation. Acute inflammation is mediated in 3 steps. Let's take a look at the chart. This is normal capillary bed in a tissue. This is the arteriole. It forms a capillary nexus and there is a venule. There are surrounding macrophages and lymphocytes in the extracellular matrix. If you take a look at acute inflammation, the blood flow to the capillary bed is increased. Arteriolar dilatation occurs and the delivery of blood is quite high in volume. This is point number 1, increased blood flow. Increased blood flow causes increase in temperature called calor and increase in redness or erythema called rubor. Let's look at point number 2. Because of this increased blood flow, the extracellular matrix is expanded by the extracellular fluid which accumulates. The more the blood flow, the more the extracellular fluid that accumulates here. Because of this edema, deposition of fibrin and other plasma proteins occurs. From the vasculature, there is increased permeability and therefore fibrin and other plasma proteins are accumulated in the extracellular matrix. This is called edema. Accumulation of plasma proteins and fluid in the extracellular matrix is called edema. 2. This increases the size of the swelling and this is called tumor. Now, because of the aggregation of these plasma proteins and increased vascular permeability, a lot of cells extravasate into the surrounding space like neutrophils. This cellular response elaborates a number of inflammatory mediators which leads to development of pain. Development of pain is called dolor. Therefore, acute inflammation is characterized by 4 different characteristics. 1. Calor and rubor. That is because of increased blood flow. Calor is increase in temperature. Rubor is increase in redness or erythema. 2 is increase in size of the swelling. That occurs because of increased vascular permeability and accumulation of plasma proteins and cells extracellular matrix. This is called tumor, which increases the size of the swelling. Because of these cells which come out into the extracellular space, Inflammatory mediators are elaborated from these cells, and this contributes to the development of pain, and this is called dolor. These are the 4 characteristics of acute inflammation. Let's write them once on the board. Now let's list out the 4 characteristics of acute inflammation. 1. Increase in temperature called calor. 2. Increase in erythema or redness called rubor. Increase in size of the swelling called tumor. And 4. Increase in pain or the presence of pain called dolor. These 4 characteristics of acute inflammation were actually revealed or discussed at length by a Roman pathologist called Celsus as early as the 1st century AD. So these responses were already known to physicians of old times. Let's look at the causes for acute inflammation now. If you take a look at the board, acute inflammation may be caused by infectious agents like bacteria, fungi, viruses, or other parasitic infections. Trauma may also cause acute inflammation. Trauma may be of 2 types, blunt